once again, and welcome to the Food Service Guidelines and Nutrition Standards Landscape Review Results Meeting of here in Baldwin County, Georgia. Like he had already introduced me, my name is Vann, and I am a Bachelor of Science in Public Health candidate, soon to be graduate from Georgia College and State University in just a short week and a half. And yeah, it's very exciting. In my last semester at Georgia College, I did a full-time internship where I served as the public health nutrition analyst for Georgia College's Center for Health and Social Issues. We are the outreach arm of Georgia College and State, and this project is between us, the center, and the North Central Health District Department of Public Health and their SHINE program. So the SHINE program, if you're not familiar, it's about supporting health initiatives and nurturing equity here. And it's a CDC-funded 5-year co-op agreement that is a part of the racial and ethnic approaches to community health. This program is aiming to improve health not only here in Baldwin County, but also in Hancock and Washington County as well. They're working to prevent chronic disease and reduce health disparities through numerous programs and focuses, some including vaccines, early childhood education, nutrition, and they're also doing some streetscapes and projects along those lines. And this project is just a component of their nutrition aspect. And so the SHINE program is working with partners and local community members in coalitions such as yourself to enhance the current resources we already have here in Baldwin County and to address the health needs and needs of our residents here. So for our project, we were using a nutrition strategy, and we're aiming to implement local level policies and activities that are promoting food service and nutrition guidelines that are associated with healthy food procurement in any facilities that food is being sold, served, or distributed. And for this project, we broke it down into 2 main outputs and milestones. The first being our landscape review so that we could gain a better understanding of what's going on here in Baldwin County, and that's what we're primarily discussing here today. And our second milestone, which is developing the action plans for each institution so that they can implement food service guidelines if they haven't already, or to enhance guidelines that they already have. Our short-term goals of our project was to increase access to healthier foods and beverages with a long-term goal and outcome of improving the health behaviors and health outcomes of our residents here in Baldwin County. And our way to do this is through implementing those guidelines. So although many of you here are already familiar with food service guidelines as you work in food service, for those of you who may not be familiar, food service guidelines are standards for healthier foods and beverages and food service operations within facilities that food is being sold, served, or distributed. Keyword, or distributed. By using and implementing food service guidelines, they may contribute to the health and wellness of employees or residents who are consuming the food within these settings, while it can also working towards changing the societal norms surrounding and to create expectations for healthier foods and beverages to be accessible and available in the settings that our residents are spending the majority of their time. By implementing these guidelines, it can also work towards strengthening our local food systems and improving the each individual's facility management of their natural resources and their energy efficiency as well. And overall, by implementing them, it can also work towards reducing the harmful environmental impact of our food systems. And this is important because people often lack access to the healthy foods and beverages in the areas where they live, love, work, and play in. Within these settings, they're often consuming foods from vending machines or cafeterias, with the CDC finding that 7 million adults eat or drink at a cafeteria every single day, and 9 million do so from a vending machine. This is important because the foods that people are receiving within these settings is often nutrient lacking, high in empty calories, high in sodium, high in solid fats, high in added sugars, and refined grains. And these foods can ultimately, by consuming them long-term and progressively, can lead to unhealthy diets and negative health outcomes. And this is important because unhealthy diets increase your risk for disease throughout your lifetime. Each year, chronic diseases such as obesity, heart disease, and type 2 diabetes are accounting for 70% of all deaths here in the United States. And poor diets are a leading contributing factor to these deaths and to developing these chronic illnesses throughout one's lifetime. It's been found that 9 in 10 Americans consume too much sodium, and 1 in 6 pregnant women have iron levels that are too low. And our goal is by implementing food service guidelines and nutrition standards will not only increase the availability of healthier foods in beverages, but our goal is to also change the health behaviors and outcomes associated with choosing these foods in a goal to lower these statistics. And as well as many of y'all already know, the US spends an extreme amount of money on healthcare. And not only that, specifically when we're targeting chronic diseases, our expenditures are just rising and rising. Nearly $173 billion a year is spent on healthcare for obesity, and our goal is by implementing these guidelines, improving those behaviors and outcomes, is to reduce the long-term amount of money that we're spending on treating these chronic diseases and the effects of these unhealthy diets over a prolonged time. And our goal to do that is by implementing these guidelines. And they can be used in a wide variety of settings, which many of y'all are representing here today. It can be implemented anywhere that food is being sold, served, distributed, such as our government facilities, as where we are today, hospitals, healthcare facilities, our nonprofit organizations and churches, colleges and universities, jails, prisons, private work sites, and food pantries and food banks as well. And within these settings, there's a plethora of venues that these guidelines can be implemented at within these settings, such as any cafeterias within the settings, vending machines, micro markets, concession stands, or any snack bars that are present within those settings. And when we're trying to implement these guidelines, it's important that we don't reinvent the wheel. We don't need to create new guidelines for all of these institutions to implement. There's a perfect guideline already out there for us, and this is the Food Service Guidelines for Federal Facilities. This was released in 2017 and was developed by over 60 different scientists and food service workers from 9 different federal departments and agencies. These guidelines were designed to be adaptable to almost any setting and venue, including many that y'all represent here today. And these guidelines are broken down to 4 main areas that they provide specific standards for. The first being the food and nutrition aspect, and this is aligned with the 2015 to 2020 dietary guidelines for Americans. And this is where we are increasing the availability of healthier foods by providing standards on ensuring that that food is meeting the nutritional quality that it needs to. And the second component is the facility efficiency, environmental support, and community development aspect. And these are policies and standards surrounding waste diversion and procurement within facilities, and working towards improving that facility's energy efficiency and their environmental performance overall. The third aspect, food safety, this is aligned with the food code, and this is where we are working towards protecting against the spread of foodborne illnesses, as well as working to prevent those foodborne illnesses through policies surrounding food safety, food practice, and food handling. And the final section of the Food Service Guidelines for Federal Facilities is the behavioral design component. And this is where current research has led us to this part being developed. And this section is all about policies surrounding the encouraging residents and community members to select healthier foods and beverages, whether that be through product placement or just by genuinely offering a higher percentage or number of fruits and vegetables being available to them. And so for our project overall, we broke it down into three main sections. The first being our informational listening session, which many of y'all had attended here in January of this year. For that listening session, we're gauging our stakeholders' interests, as well as introducing the project to our stakeholders and beginning to open that policy dialogue and conversation surrounding how to go about this project and how to implement food service guidelines and nutrition standards at these institutions. The second part of our approach, which is what we have just completed and are mainly discussing here today, is our food service guidelines organizational assessment. And this occurred from February, and this will be wrapping up on April 30th of this month. And our next step is the implementation focus, and this is coming in May and June, and we will get into this more in just a little bit, but this is where we will be developing the action plans for these institutions. So in looking at our assessment and how we chose to assess, we did receive the Institutional Review Board approval from Georgia College and State University, and there you can see our approval number. And we began by recruiting all of our stakeholders through email of anyone who was meeting our sampling frame, which included institutions in Baldwin County that sold, served, distributed foods, excluding public schools, restaurants, and grocery stores. We were then decided to collect our data using Qualtrics and primarily using the CDC's food service guideline organizational assessment tool. This is just one of the tools in the wide toolkit that they have when it comes to communities attempting to implement these guidelines within their communities. We offered our surveys either in person with Dr. Francis and I or over the phone. We conducted our surveys on Qualtrics, and our data was then pulled from Qualtrics and put into Microsoft Excel for data analysis and data cleaning and management. We then conducted further data analysis in Stata 17.0, which is a statistical analysis platform that allowed us to delve deeper into our data. And as many of y'all remember, our tool and survey was broken down into 6 main sections. The first section was agency background, and this allowed us to gain background information on who your institution is, who are you serving, how are y'all serving people, and this also allowed us to gain the proper contact information as well for institutions. And this is where we started to look at what health promotion strategies are these agencies engaging in. The second section, this is where we were looking at what food service venues are present within each agency and looking at what meals are being served out of that venue, as well as the amount of meals being served out of those venues. And the third section, this is when we were looking at the nutrition standards and policies that are in each guidelines, and where we were trying to survey it to see what topics are being addressed, as well as if they have any guidelines, if there are any sustainability standards addressed within these guidelines as well. The fourth section was the authority over food services, and this is where we were trying to get a better understanding of what it would look like for each institution to implement food service guidelines or to adopt better policies surrounding food service guidelines, trying to gain a better understanding of what that would look like, whose approval would be needed in those situations, and who's currently over enforcement of food service guidelines for institutions. We also gathered data surrounding the contracting process, and this is where we were looking at how agencies make their agreements, whether that be through a contract, permit, or other, as well as we were looking at if they do have current contracts, what is currently available to us within those contracts. Are we available to make any changes? And also looking at how long they renew for as well. In the final section, environment and capacity, this is when we were looking at what challenges that agencies are facing, whether that be with developing and or complying with food service guidelines, as well as looking at what information would be helpful for them moving forward when it comes to creating and using food service guidelines. And primarily the second part allowed us to collect data for our action plan for our next step. And when looking at our results, looking at what health promotion strategies that agencies were engaged in, we found that 37.5% of institutions here in Baldwin County were not engaging in any health promotion strategies. 25 or 1/4% engaged in nutrition policies to increase the availability of healthier foods and beverages, and 19% participated in health education, whether that be to their residents or their employees. 12.5% identified other, which included outside education resources for their patients, offering a clinic to their employees, or offering incentives or reimbursements for gym memberships. We also saw that 6% included employee screenings as a type of health promotion strategy. And when looking at what venues we collected for our landscape review here in Baldwin County, we did have 16 surveys for data analysis, and we had 7 distributed meal programs, and this was primarily our food pantries and our food banks and senior citizens, and we had 3 community agencies, 3 colleges and universities, 2 assisted living facilities, and 1 hospital. And then looking at what food service venues agencies are using to sell and serve food, when looking at where food is sold at in Baldwin County, 43% of food is being sold through vending machines here, and 28.5% is being sold through cafes and cafeterias. 28.5% of institutions also identified other, and I know that this included some of our micro markets that were newer and unmanned concession stands as well. Then for served at, 61.6% of our meals in Baldwin County at these institutions are served through a distributed meal program, followed by 23% identifying other, and this included our soup kitchens, and then the 15.4% identified as serving foods to meals to institutionalized populations. And then looking at the nutrition policies and standards component of our results, when looking at if agencies currently follow any food service guidelines, 10 institutions reported that they did, 5 reported that they did not, and 1 was unsure if they did. And looking at if of those 10 who did, if those guidelines were mandatory or voluntary, 9 said that they followed those guidelines because they are mandatory, and 1 said they follow them voluntarily. And when looking at what rationales agency used for implementing and using these food service guidelines, 43.7% of our institutions used them because it aligned with their agency's mission and purpose, and 25% said that they were doing them to model healthy and sustainable practices for other agencies. And you can see that we had a limited number of those using them for the prevention of obesity and chronic diseases, as well as economic benefits for local farms and to improve employee health. And then looking at the actual topics that are addressed within the food service guidelines of those institutions that did have guidelines, the number 1 guideline that was most present was the promotion of fruits and vegetables, followed by calorie information through labeling, sodium being addressed, and signs and symbols that are indicating healthier choices. We also saw that a majority of our institutions identified that their guidelines addressed calories and saturated fats, as well as reduced portion size and dairy. We did only have 1 institution identify that beverages or the placement of fruits and vegetables or the percentage or number offerings of fruits and vegetables was identified within their nutrition standards or food service guidelines. And some of the other topics that were addressed that our institutions identified were increasing baked options, including no and low sugared beverages, and policies and topics surrounding food storage and food handling. And of those institutions that had these guidelines, when looking at what sustainability standards were addressed within these guidelines, the most common one that we saw was 37.5% of our institutions offered free drinking water, or that was within their guidelines. 25% participated in waste reduction, recycling, and composting. But overall, you can see that we had a pretty low number of sustainability standards being addressed within guidelines here in Baldwin County. And when we were looking at what challenges our agencies are currently facing in regards to the development and or compliance with food service guidelines, the number 1 challenge faced currently is a lack of funding support or concerns about cost implications when it comes to implementing these guidelines, followed by customer dissatisfaction with changes or a lack of consumer demand for healthier food. Overwhelmingly though, when grouping these challenges, we saw that the most present challenge was fiscally related, followed by issues with staffing or volunteering when it came to our places that did not have staff, followed by customer issues and challenges. And then some of the other challenges that were identified by our institutions were lack of availability to get healthier food due to rising food costs, size of facilities presented as a challenge, lack of shelf-stable healthy offerings, lack of volunteers, and also issues with volunteers that are ever changing as well, supply chain issues, and finding healthy prepared food that is not raw, or some of the other challenges that were addressed by our institutions. And then when we were looking at what information would be helpful to these agencies when it comes to them developing and or enhancing their food service guidelines, we saw that 68.7% of institutions indicated that they would like a website designed and dedicated to food service guidelines and resources, followed by assistance with training for their staff and or volunteers, and then following by how to market and promote healthier items. And some of the other helpful information that our stakeholders identified was help with how to introduce behavioral change, introducing classes for volunteers, and guiding them through food service guidelines, creating patient education or education and recipe cards for the community was something, and then also by implementing and assisting with brokering sustainable food bank partnerships long-term here in Baldwin County. Although there are many other results, you can see those in your packet that is within your folder, but some of our key takeaways of this project and of the results we divulged today was that although several institutions currently have food service guidelines in place, there are several improvements that need to be made. We saw that vending machines were the most frequently reported venue used here in Baldwin County. And this is where we have a really neat opportunity within the action plans to implement behavioral design components that will encourage the selection of healthier foods by our residents. We also saw that there was a limited engagement in health promotion strategies, which is something that we would like to address moving forward in the action plan, as well as that 1 in 3 agencies reported not using any food service guidelines. This is something that we are wishing to improve on, and we're not only wanting to improve it, we're also wanting to improve the enhancement of these guidelines in places that already have them in place. Of those that do already have guidelines, we saw that there was a lack of information on sustainability standards that was currently being addressed. And then we also saw that development and/or compliance is mostly being affected by a lack of funding support. And this is something that we would like to think on and work towards moving forward. So for the next steps of this project, this will be occurring between May and June of this year, and this is where we will be developing action plans for your institutions. We will be guiding your institution on how to develop, implement, and/or enhance your existing guidelines in order for it to align with either the food service guidelines for federal facilities that we discussed earlier, or the healthy eating research nutrition guidelines for charitable food systems. Our goal is that through these action plans, we will be identifying the settings of focus within your institution, as well as goals, objectives, and strategies for implementation of these institutions. We do ask and invite you to email a copy of your food service guidelines, contracts, nutrition standards, or anywhere that is placed within your institution. If you could email that to me by April 30th, that would be lovely if you have not already done so. And throughout this internship and this entire project, I have learned so much, and I've been able to take so much away from this and grow. But one of the primary things that I learned was the importance of stakeholder engagement, as well as how important it is to engage stakeholders from diverse sectors, because this allowed us to gain crucial and unique information that we wouldn't be able to gain otherwise if it wasn't to include all of our sectors within the food systems. I was able to gather data on the unique challenges faced within each setting, and this allowed me to learn so much about the behind the scenes of food service that I was not aware of before, and it really opened my eyes. I also learned a lot about the challenges of data collection, as we dealt with gaps in some of our data submission due to varying levels of responsiveness, while also dealing with levels of no response. This is something that I'm going to be able to use as a learning opportunity moving forward, and especially in grad school and as I continue on throughout other research projects. I also learned that when assessing food service guideline landscapes, it is direly important to use both qualitative and quantitative approaches, because using both allowed me to gather information on the attitudes, beliefs, and perceptions of those in charge, while also gathering that statistical and numerical information regarding the evaluation and enforcement of current guidelines. I also learned techniques related to opening that local policy dialogue surrounding food service guidelines, and how to promote food service guidelines and nutrition standards within a wide variety of settings. Throughout this research and our project, there were several implications for public health, and we were primarily able to identify gaps, challenges, and opportunities for tailored interventions for our institutions here in Baldwin County. And through this, we'll be able to meet the actual needs of our residents. We'll also be working towards increasing availability and accessibility to healthier foods and beverages, and working on enhancing institutional policies that can work towards benefiting community health outcomes, as well as creating that societal expectations for the availability and accessibility of healthy foods within these institutions. We're also working to address sustainability efforts here in Baldwin County that have not been addressed before, and fostering partnerships and collaborations among institutions that have not been in place that will be beneficial to the community working forward. Throughout this project, we were also able to identify the gaps in current research, as well as identifying areas that we would want to pursue further in research surrounding food service guidelines and nutrition standards. Ultimately, this was a wonderful learning opportunity for me, and I'm incredibly thankful for being able to work at the Center for Health and Social Issues. And I'm also incredibly appreciative of all of your work with me this semester and your diligence in coming today. Thank you.